In the last video, we talked about the parasympathetic nervous system, which is our rest and digest arm of our autonomic nervous system. In this video, let's discuss muscarinic antagonists or anticholinergics. So muscarinic because it's affecting the muscarinic receptors. It's binding to and blocking the muscarinic receptors. Anticholinergics because our parasympathetic nervous system is cholinergic. It releases acetylcholine. So atropine is a big drug in this class. Atropine is used for several things, one being bradycardia or heart block. So with both conditions where our heart rate is slowed down, we need to bring it up. Another one is, say someone's going into surgery and they need to be intubated. They may give them atropine to decrease secretions. Remember, a parasympathetic activity is increasing salivary secretions and respiratory secretions, airway secretions, so you want to block that to allow easier access for intubation. Another one is an optometrist may use it for an eye exam. If they need to open up the pupils, they can dilate those pupils and do a better eye exam that way, because remember the parasympathetic nervous system causes constriction of the pupils. So if you oppose that, if you block the muscarinic receptors, those M3 muscarinic receptors there, it'll cause dilation. And then if someone's in a cholinergic crisis, so their parasympathetic nervous system is out of control, they may end up in some type of shock or heart rate so low that it's decreasing perfusion. You can actually give atropine as an antidote to cholinergic crisis. There's another situation called death rattle, where a person is right at the end of their life, and right before they pass away, they build up all these secretions. And just to make that process more comfortable for them, so they don't basically choke on their own saliva and have a traumatic death, they'll give them atropine just to kind of ease that process. So that's a big drug that's anticholinergic. Another is Oxybutynin. If you think about the parasympathetic nervous system, rest and digest, it also facilitates urination. So Oxybutynin is a drug for overactive bladder. So if someone has urinary incontinence, overactive bladder, you can give them Oxybutynin and it will help with that situation. So it blocks those muscarinic receptors that try to facilitate urination. Same thing with defecation. If someone has irritable bowel syndrome and they have a lot of diarrhea and you want to slow down that process, you remember parasympathetic rest and digest, it's increasing the GI motility, and that is not going to be good if someone's struggling with diarrhea. So you can give them a drug called dicyclomine, which will slow that process down by blocking those muscarinic receptors and helping that process. Another very common one, and I've used this one before when I went deep sea fishing, was scopolamine. So on our medulla, we have an emetic center, which is our place in the medulla that causes nausea and vomiting. There's a lot of muscarinic receptors here, and so if your vestibular system is tied into this emetic system really close, and so if someone is going, for motion sickness, they can put scopolamine patch on the back of their ear, and it will block those muscarinic receptors right there at that emetic center and decrease the nausea and vomiting. Also, even with post-op, so someone a lot of times will come out of surgery and feel nausea and vomiting. They can use scopolamine to decrease that negative process. So these are some drugs that work in the parasympathetic nervous system, and I'll see you in the next one.